The Trevor Project actually did a study
Yes.
on the implications of COVID-19 for queer and trans youth mental health, and outlined several strategies. And I'll name one of them, and then I'll offer one myself. One is to increase positive social interactions. And part of that would be to encourage, or even to, well, encourage our teens and young adults to say it's okay to not be okay, just like what's on behind Daniel's flag there, or saying, and really validating their experience, that what you're experiencing right now matters, and that we are here to journey with you, to accompany you during this very difficult time. And part of that would be educating our churches. This is something that's been said already, about how to spot youth when they are showing symptoms of depression, anxiety, and particularly if they're thinking about suicide. And this is something that we can all learn as faith leaders, is to do some psychoeducation along those issues, so that we can then enable ourselves to spot those kids and young adults who are in some ways evidencing some of those symptoms. We can also utilize resources within the church. We've got Christian therapists, psychologists in the church who can do psychoeducation on a regular basis. Part of spiritual health is mental health. The two are actually not divorced. Part of caring for the soul of another person is to look at them holistically. But for my queer and trans siblings, of all colors and shapes and degrees of fabulousness, in the movie Moana, and I watched Moana, Moana said to Tefiti, remember who you are. And who are we exactly as queer and trans, Black, Indigenous people of color? Who are we? Here's my take on that question. And I hope that this will somehow be a bread to your journey. Yes, you are loved as you are. And your love, your queer love, is as pure and genuine and true as the love of another person. So let us celebrate that love. Love that mirrors the consummate love of Christ. A victimless, gratuitous, and creative love that declares with such delightful cheer that you are without a doubt God's beloved queer. And I think that is something that I would like to just kind of share to my queer and trans community of all shapes and colors and fabulousness.
Yes, belovedness. I love it.
Yeah, to jump in the conversation as well, you know, as I'm thinking about this within my own communities and about mental health, there's a layer, you know, within general, you know, American communities, there might be this, we talk about stigma, but there's something else that I don't know how many of folks from my own immigrant kind of first generation kind of communities are thinking about when it comes to honor and dishonor. So for instance, when like, so what I see in my own communities is just this aspect of, if I were to talk about this mental health, if I were to name it, if I were to speak about it, I might bring dishonor to my family, might bring dishonor to my community. I might, if you think of like a white sheet, like this white shirt, there might be a little spot that's on here, and that'll shame my community, shame myself, my family. And sometimes, you know, I haven't seen research about this, but I think a lot of this has to do with like marriage prospects as well, being able to meet someone, right? And so I know in our communities, folks try to keep them on the hush hush, not talk about it, keep it hidden, as a way to, you know, try to save face. You get it? So when it's seen as like, when the person is identified with, you know, the illness, then that's very much the direction it's going to go towards. But when it's not, when it's seen as part of the human condition, right? Like mental health is something we all have, you know, and then so like, why not talk about it? Just like, this is part of our condition. And so I get very passionate about this within my own friends, family. I mean, so I start the conversation with myself, and it's not a weakness to talk about it. I don't bring, and I'm in a special place. So I want to use my platform, my authority, my own training, my opportunities, you know, so what I appreciate what Daniel brought up earlier is that like we can use our own narrative, our own story. I mean, so they ask, how do you do it? You model it, but you have to be genuine and authentic about it as well. And, you know, teens, young adults can see right through, you know, our facade, you know, so we got to be real.
Generationally, authenticity is a huge marker for people who are in their 20s and teens, statistically.
I also think another addition to this is also rethinking, connecting sociology to this conversation as well. African American youth, teens, and young adults struggle at the highest rates of social injustices. According to the Centers for Disease Control, it is African American persons who have the highest rates of poverty, unemployment, lack of housing, and an inability to see a medical doctor, or lack of healthcare insurance. And so when we talk about suicide and mental illness, it is so important for us to also connect the dots to the ways in which social injustice and healthcare disparities also impact one's mental health. And so what can faith leaders do? What can the church do? I would push the church to think about what are the social service initiatives that a particular faith community is becoming involved in, particularly around poverty, unemployment, lack of affordable health care, and housing.